presentations under this. Now this is the next discussion is we are to talk about pulmonary artery pressure in rheumatic heart disease. If somebody has rheumatic heart disease, what is the state of the pulmonary arterial pressure? Okay, sorry, I didn't call it right. It's pulmonary arterial pressure. Okay, so pulmonary arterial pressure is usually elevated. That's the first thing you usually see. Okay, so it's usually elevated due to chronic valve damage, especially the mitral valve is damaged. But let's discuss it better. So give reasons why pulmonary arterial pressure will rise in rheumatic heart disease. First reason is there's valve lesions. So rheumatic heart disease commonly affect the mitral valve. So if there's mitral stenosis, there's blood being held back, blood is not flowing well, so atrial pressure, that's pressure in the right atrium, will rise, which transmit back into the lungs, okay, into the lung circulation. So that's what actually increases the pulmonary arterial pressure. So chronic remodeling, so as the pressure stands there for a very long time, it leads to enlargement of the atria, the right atria. It could also lead to enlargement of lung tissues. Then you can have fibrosis. So cells in the lungs could actually start dying off. So right heart strain. So elevated pulmonary arterial pressure eventually causes right ventricular hypertrophy or failure. Okay. So typical findings. Pulmonary hypertension shows, it will basically show, the pulmonary hypertension is actually one of the most important findings in this. Okay, then severity. So pulmonary arterial systolic pressure can range from mild elevation. So when you say it is mildly elevated, it's between 30 to 40 millimeter mercury. If you say it is severe, you say that from 70 millimeter mercury up. Okay, this is actually depend on the lesion. Okay, so you diagnose this using echocardiography and also the right heart catheterization. So that's basically it. All right, so the prognosis depend on if it is mild